slight tinnitus, how to get rid of it without spending any money and in your own home? Yes, it can be done, and you can learn about it watching this video. So please hit this subscribe button, sit and watch for just a few short minutes this video will take. Now you may ask, why are we so sure about the results? You see, we are specialists working with this condition for a long time, as we have seen many thousands of tinnitus patients last 15 years. So as you would expect, we do have educational background and training, and that's not even bringing up our level of knowledge or experience in this field. And we want to help you. So let's talk about slight tinnitus, shall we? You may want to know that the Tinnitus Handicap Inventory Scale Score can reveal how intense and annoying tinnitus truly is. You can find out more about it on our website or in many other specialized clinics. Now comes the part that is truly important. The first step in taking control of any medical problem is accepting responsibility and viewing yourself as the most important person in the treatment or therapy process. Yes, absolutely, use any guidance you may have received from doctors or specialists. But ultimately, your health is your responsibility. Be involved in your own care. Get informed about your healthcare options and seek the best professional advice to help yourself achieve your health and wellness goals. In other words, you are responsible for managing your tinnitus, and no miraculous medications or other remedies will work without your participation and effort. Okay, now it's time to tell you what we want you to do. And this is nothing more than enhancing habituation by putting all the preconditions in place to make this process effective. Usually, with tinnitus at a slight level, we don't require treatment or therapy, but we do need someone who understands what we are hearing to advise us on what to do. Then it's time to shift our focus from excuses and tears to finding solutions and taking care of our tinnitus. Trust me, many people with minor tinnitus have found success with proven methods and techniques worldwide. Please do be aware, though, that if you have other conditions in addition to the slight tinnitus, such as decreased sound tolerance, hyperacusis, high levels of chronic anxiety, hearing loss, or others, you will still require a proper tinnitus assessment and specialized tests. But if you only have slight tinnitus, we have simple solutions for you. Avoid loud sounds. Use noise protection like earmuffs. And if you're exposed to loud noise, do make sure you have controlled and limited exposure to noise or stimulation to keep the auditory system functioning. Sometimes infections can cause tinnitus or make it a lot worse. Do protect yourself and take care of yourself, especially in the fall and winter. Eliminate nicotine and caffeine and lower the salt intake. Please note that any substance known to affect the patient's blood pressure will have a very profound effect on tinnitus. If you know your blood pressure is high, check it often and talk to your doctor. Avoid stressful situations and learn to cope with the stress and anxiety. During therapy or treatment, we educate our patients how to cope with anxiety and tension. We also discuss how to stop anxiety or panic attacks from happening and how to spot them early. Cooperation and basic rules such as listening to guided meditations or practicing relaxation techniques are still needed and recommended. Please do pay attention to how your tinnitus might seem when you are truly relaxed and well rested. Another way to see if stress is having an effect is to watch what happens later on throughout the day. Does your tinnitus bother you more or get louder? If this is the case, you have immediate confirmation that your stress levels are affecting your tinnitus. Rest. Try to get at least 8 hours of uninterrupted sleep every night. Good and proper sleep techniques have a very profound effect on our stress and anxiety levels. They allow our brain to reset some important functions and improve brain efficiency and lower tension, stress, and anxiety. Avoid too much quiet. There should always be low volume sounds in your listening environment, whether it's soft radio music, birds, rain, white noise, or any other sound you are comfortable with. We strongly recommend the noise generators created for this very reason that we use in our clinic, as they are much more effective than the fans that most people with tinnitus use at night. You can see that they are quite different from the white noise machines sold commercially. Don't hesitate to get in touch with our clinic to learn more about this essential piece of equipment that can significantly impact whether or not you can hear your tinnitus and whether or not you can get rid of it. We only endorse what has been proven to work. Avoid focusing on tinnitus. It can be tempting to think about it all the time or talk about it with your family, but it's important to find a balance. It may not help to completely ignore tinnitus, but it also doesn't help to think about it all the time. This is an integral part of your treatment. In fact, we are planning to make a video explaining this topic soon. And finally, alcohol use can increase blood pressure, which can amplify tinnitus. Smoking can narrow the blood vessels that supply oxygen to the brain, and it can also raise blood pressure. So it's best to avoid alcohol and smoking if you have tinnitus. For more information about tinnitus habituation and the habituation process, please watch the new video that will be posted on YouTube soon.